On his way out the door, President Biden said he wanted to make weight loss drugs available to every American who may need them. So what does that mean for so many who take the drug when the administration changes? Certainly members of Team Trump have said that they want to do that and more, even proposing hypothetical lower prices and more access. So will President-elect Trump follow through? Defender depends on who has his ear, for certain. On one hand, there's Robert F. Kennedy Jr., who thinks the best way to make America healthy again is through diet and lifestyle and not weight loss drugs.
We're spending $1,600 a month on this drug. There's a bill right now before Congress that will make it available to everybody who's overweight, which is 74% of the American population. That alone will cost $3 trillion a year. If we spent about 1/5 of that giving good food, 3 meals a day, to every man, woman, and child in our country, we could solve the obesity and diabetes epidemic overnight.
On the other hand, you have Elon Musk, who thinks accessible weight loss drugs would solve everything. He, quote, says, "Nothing would do more to improve the health, lifespan, and quality of life for Americans than making GLP inhibitors super low cost to the public. Nothing else is even close." Let's bring in Director of Medical Weight Management, West Virginia University, Dr. Laura Davisson, who watched an experimental program play out in West Virginia where employees did get access to cheap GLP-1 drugs and what it did. Doctor, thank you so much for joining us. Quickly, tell us the impact that it had.
Hi, thank you for having me. So I run medical weight management program here at WVU in Morgantown, West Virginia. And the program was a statewide program that offered GLP-1 medications as part of a comprehensive program statewide. And I run the Morgantown program. The results we saw were incredible. Our patients lost 15% of their weight. They had improvement in multiple health conditions, including their blood pressure, their hemoglobin A1Cs, which is a marker of diabetes, their cholesterol. They were able to come off of certain medications. They were able to do more and feel better. And overall, they just had incredible health benefits. And I think this could be a remarkable tool that could really help our state, because we're in West Virginia with the #1 rate of obesity.
Well, and I'm looking at some numbers. As you mentioned, according to the West Virginia Department of Health and Human Resources, the obesity rate is almost 42% in your state. We look at some of these prices, Ozempic, Mounjaro, Wegovy. I mean, it's around $1,000, if not more, a month. That is simply something that folks cannot afford. So can you tell me the program, if it was so successful, why was it taken away?
Obviously, these medications have a very high price tag. We understand that. And we understand that the state employee insurance program was struggling with costs. So we are not expecting them to expand the program. That is understandable. But if you want to be financially responsible, they already invested millions of dollars in treating patients in this pilot program. It was a small number of people. All the people in this program were just treated at these very limited centers of excellence. And if we stop the program now and let these people who got treated regain their weight, and we don't follow their outcomes long term and see what the potential benefits are, that's not financially responsible. We need to keep these people on treatment and see what the long-term outcomes are, because potentially this could be part of the solution to their financial problems. If it turns out that treating this obesity aggressively could actually help turn around the health of the state and maybe reduce all the costs of the taking care of their health.
Well, that leads me to my next question: is how do you not know that that it didn't offset the cost of the drug by alleviating some of these other health costs?
Yeah, I think a lot of these health problems are going to take years for us to really see the benefits. And you know, that clip from RFK Jr. was interesting. You know, we do know that eating healthy is a part of this and exercising is a part of this, but there's a difference between prevention and treatment. We have the highest rate of obesity in our state, and we also have a high severity level of obesity. We have patients walking into our clinic who are 600-700 pounds. And when the state employee insurance cut off this program, you know, they offered patients in exchange a gym membership. You can't, I think everyone knows that if you have someone who's 600 or 700 pounds, a gym membership is not going to be able to treat their obesity effectively. Exercise, eating healthy can help with prevention perhaps, but a patient who has that severity level of obesity needs treatment. They need something more than a gym membership. They probably can't even move and exercise at that point.
You know, quickly, can I just get your takeaway? What was your takeaway from this year that you witnessed?
So, you know, I think we know that a lot of insurance companies across the country are struggling with this. It's not just this particular insurance company. And what we tell a lot of insurance companies is this is probably the exact kind of program they need to implement, where you let certain centers of excellence who are experts in treating obesity prescribe under very controlled circumstances where patients get all of the dietary counseling, all of the exercise counseling and lifestyle to go along with the prescription. And that's exactly what they did in this program. So we need to carry this through, see what the long-term results are, because this could potentially be a model for other insurance companies who are struggling with costs to say, this is how you can actually implement coverage of these drugs in a very responsible way.
Yeah, Laura Davisson, thank you so much for joining us. The pilot program was unbelievable. It was really interesting to read about. Thank you so much for joining us on this holiday week. We appreciate it.
Thank you.
Thanks for watching. Go to joinnn.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.